I read an interesting study the other day from the American Journal of Obstetrics and Gynecology. It was titled Race Matters, Maternal Morbidity in the Military Health System. The article began by stating the dismal statistics that we all know, that in the U.S., Black women are 3 to 4 times more likely to die from childbirth and have a 2-fold greater risk of maternal morbidity compared to their white counterparts. It's often hypothesized that the reason this occurs is due to lack of access to health care or other socio-economic factors that make it harder for Black women to interact with the healthcare system. And so, looking at the military, where members have access to care, this eliminated that question, in that if everyone in the military has equal access, Black women, white women, Black pregnant women, white pregnant women, we shouldn't see the difference in racial health care morbidity in regards to childbirth. Reasonable. If you level the ground, if you make healthcare accessible, we shouldn't see the disparity. And so this was a study done at 13 military hospitals, which were considered high volume hospitals, meaning that they did over 1,000 deliveries in a year. And what they saw when they looked at the statistics, that even in the military, Black women were more likely to have a cesarean section. Black women in the military were more likely to be admitted to the intensive care unit, and Black women in the military were more likely to have severe maternal morbidity compared to the white counterparts. And so this raises some really interesting questions. Now, the authors of the article go on to say, now we don't actually know if the rank of the Black or white persons in the military made a difference, meaning that irrespective of access, your rank in the military might determine your level of care. They also went on to say that they didn't know whether or not the Black versus the white members of the military had pre-existing conditions which would have made them more likely to encounter maternal morbidity, such as diabetes, obesity, hypertension. So they didn't know that, and they didn't know the rank. But they did say in the article that even when you level the playing ground in the sense that you make access available to all, the maternal, the racial disparities still exist. And they raise the possibility that, and this is the one that we need to consider, that maybe there is existing medical racial biases inherent in the system. That means even when you can access care, you're still subject to racism. So it's an interesting article. It provides a lot of food for thought and reflection as we wade our way through why is it that as this country we are seeing an increase in maternal morbidity for all women, but particularly for Black women.